angioplasty, targeted cancer therapies, better antibiotics, relief from asthma, from acid reflux, from psoriasis. All represent breakthroughs. These topics also are a small sample of the contributions local physicians have made. By participating in clinical trials, they have improved patient care.
Most people don't realize that we have the depth of research going on in our own community.
Thomas Vidic is a neurologist whose clinical research has allowed him to try promising new treatments when other possible solutions have all been exhausted.
This is especially true with our Alzheimer's patients. I just had one of the family members in my office a week or two ago going, "What's next? Where do we go? This one drug we were working on didn't get approved. How can I help my wife?"
Okay, there's final pressures.
Cardiologist Donald Westerhausen was in on the early studies that developed the use of angioplasty and stenting.
I like being involved in clinical research because basically I can take new treatments, new modalities that we've learned in the research trial and use it in our patients literally within weeks to months after the trial's completed and reported. Where other physicians it might take literally years to use the same treatment.
Often researchers are motivated by the relief these trials bring to patients, as in the case of Dr. Mamoon Raza's work with a non-invasive procedure to treat acid reflux.
Resolution or improvement of symptoms after the procedure is almost immediate. Many people leave the hospital or wake up from the procedure not experiencing their symptoms that they've had for years.
Let's take a look at the top of your head. You look down for me. For my psoriasis patients, they sort of come out of a shell. They become a new person.
In one clinical research project, the patient outcome was life-saving.
The morning of April 2nd, on the way into work, I was involved in a head-on auto accident. I knew right away how seriously injured I was.
While her injuries were profound, the immediate threat to her life was undetected internal bleeding. Kelly was fortunate that an innovative team from Notre Dame, the IU School of Medicine, and Memorial Hospital was exploring how to more effectively staunch bleeding in trauma patients.
I realized that we could use those resources that we have at IU School of Medicine and at Notre Dame, and to take those two entities and tie those in with Memorial.
Thomas's focus was on an existing technology called TAG. Memorial colleague and IU School of Medicine faculty member Mark Walsh joined the team.
TAG is the only test that allows the clinician to determine the ability of blood to clot.
The team turned to the IU Medical School and Notre Dame's Frank Castellino of the Keck Center for Transgene Research. These faculty members devised analytical procedures that discovered molecular-level information about how blood clots and what blood products would better help trauma patients.
By helping them understand the molecular basis, we could treat specifically the symptoms that we're able to test for with very specialized equipment.
Around the world, trauma physicians are now adapting the TAG team's findings. Here at home, no one appreciates their work more than Kelly Porter.
If it hadn't been for the TAG, this could have been easily missed. This would have been catastrophic.
The larger lesson in the TAG study is that this area's medical and academic communities are primed to engage in partnerships that break original life-enhancing ground. The presence of a 4-year medical school and growing number of physician researchers on its faculty support this vision.
The TAG clinical research is a classic example of how the medical school facilitated a partnership between the clinicians in the emergency department of Memorial Hospital and the Keck Center at the University of Notre Dame.
This passion for further involvement is shared by those already in clinical research.
So how did you feel when you were on the clinical trial?
Oncologist Robin Zahn has seen a vast number of patients helped by research trials as principal investigator for the Northern Indiana Cancer Research Consortium.
The only way to improve care of patients, no matter what their illness is to have clinical research that gives us answers to the questions. I believe that it's absolutely imperative that community physicians participate in clinical research.
We have outstanding physicians here. We have research support not only from IU but Notre Dame as well, and that partnership that has helped bring forward the medical school and to become a 4-year school is part of that. So I think this really could be an ideal community to do a lot of good clinical research in.
Coming to IU Health Goshen from an academic research setting, surgical oncologist John Abad sees broad sweeping potential for bridging clinical and basic researchers.
We're bringing these things locally to the community, and this won't just benefit the patients in this community, but also the students that are being recruited here for the medical school.
Support is at hand for physicians who want to take the next step.
It may be that somebody has a great idea, but they don't quite know how to get that started. And so the medical school can really foster that, not only for clinicians in the community, but also faculty members, both at the medical school and at the University of Notre Dame.
Identifying alternatives.
Benefiting patients.
Fostering collaboration.
Groundbreaking discoveries.
Changing lives.